Good afternoon, dear friends. We are students of the pharmaceutical faculty at Thursday Medical University. And today we would like to share with you why pharmacy is not merely a vital industry, but also a profoundly fascinating field. Pharmacy is more than just a profession, it's an entire world where science meets practice, technology meets humanity, and routine processes intersect with global challenges. Today we want to show you just how multifaceted and captivating this sphere truly is.
Pharmacy begins with science. It is the foundation upon which everything else is built. Chemistry, biology, pharmacology, bioengineering, this is where breakthroughs constantly unfold. Imagine being a scientist studying how a single molecule can inhibit a virus or halt the growth of a cancerous tumor. First comes computer modeling, followed by thousands of in vitro experiments, trials on cell cultures, and preclinical studies. Today, pharmacy is not just about pills and injections. It includes the biotechnology, monoclonal antibody-based drugs, targeting diseases with precision, the gene therapy, the ability to repair a patient's DNA, for instance, in rare genetic disorders, the nanotechnology, delivering drugs exactly where needed, for example, only to a tumor while sparing healthy tissue.
If science is the theory, manufacturing is its practical realization. Here precision, technology and scale converge. Manufacturing medicine is rather like clockwork, everything must function flawlessly. What does this process entail? Firstly, developing dosage forms such as tablets, capsules, ointments, syrups, and injections. Each requires specific technologies, carriers, and stabilization methods. Secondly, selecting excipients, ensuring the drug not only works but also remains stable, absorbs properly, and minimizes side effects. Last but not least, stability and compatibility testing, confirming that the drug remains effective during transmutation and storage. As for modern production lines, there are high-tech systems where automation and quality control play essential roles. Sound exciting? Absolutely. After all, your work determines how a drug performs in real-world conditions.
Once a medicine is created, what comes next? It just reaches every pharmacy, hospital, or even remote corners of the world. Logistics in pharmacy is not merely about transporting boxes. Temperature control, expiry dates, and varying international regulations must be scrupulously observed. A single mistake can jeopardize people's health, making this field one of immense responsibility and expertise. Moreover, it presents constant challenges: how to optimize routes, reduce costs, and ensure life-saving drugs remain accessible.
Finally, a pharmacy is not just a place to buy medicine. It is the final and perhaps most critical stage of pharmaceutical chain. Here, professionals help people maintain their health daily. It requires not only in-depth knowledge of medication, but also well-developed soft skills, whether recommending alternatives, providing consultations, or offering reassurance and support. Today's pharmacists need more than medical expertise. They must also possess empathy, active listening, and resilience, as working with people can be demanding. Moreover, modern pharmacies also involve marketing, inventory management, and intelligent technologies, such as online sales, automation, and digital workflow integration.
Pharmacy is not just a sequence of processes. It is a dynamic living system where each stage is both essential and fascinating. It bridges science and practice, technology and humanity. This profession is for those who want to see the impact of their labor in patients' well-being. If you seek a vocation that combines intellect, innovations, and compassion, welcome to the world of pharmacy.